Next question. How much fat and protein do you recommend for an average 150-pound man? I don't make the recommendations. It in part depends upon how many meals you have and how much you like to eat at a meal. I like my patients to feel satisfied but not stuffed. And since we're severely limiting the carbohydrate, the only things that remain are protein and fat. And since I'm not telling people go out and buy some fat and eat it, the fat is whatever comes along with the protein. So it's a matter of what it takes to make you feel comfortable. But there are computations that you can make. And when I sit down with a new patient, I look at the amount of exercise they get. And I do some estimating. And it's really more like guesstimating than estimating. The literature seems to suggest that a truly sedentary person, someone who doesn't go out and walk around, who sits around the house all day long, doesn't do housework, in other words, an invalid, needs 0.8 grams of protein per kilogram of body weight. And this is what they give to end-stage kidney disease patients. They at the very end, they try to minimize the protein to put off dialysis another few months. It's not been proven that they can do this, but some doctors think that it may be possible. So they take them down to the minimum, which would be 0.8 grams of protein per kilogram. So you have to convert your body weight to kilograms by dividing pounds by 2.2, and that gives you grams of protein. Every 6 grams of protein comes to 1 ounce of real protein food as you would weigh it on the scale. So a 3-ounce hamburger would have about 18 grams of protein. Now, what if you're more active? Let's say that you're a professional athlete. You might need between 5 grams and 10 and 15 grams of protein per kilogram of body weight. And you might be solid muscle and have a lot of kilograms of body weight. So that's the other extreme. And in between, if you take a person who exercises, let's say, for a half an hour a day, he might need 1.0, 1.1, 1.2, 1.3 grams of protein per kilogram of body weight. So it depends very much on how much you exercise and how strenuous the exercise is. So there's not a matter of my recommending how much protein you should eat. But the main guideline is what maintains your body weight at a healthy weight. And do you feel too full or too hungry? So if I want someone to lose weight, I'll reduce the protein below my computed amount. And if I want someone to gain weight, as I'm doing right now with a lady who's getting 6 protein meals a day, we raise the protein above the computed amount. So that's how it goes. It's not the simplest thing in the world. Read the book. It might be helpful. Diabetes Solution.